Hi everyone. My name is Dr. Vicki Stanovich, and I'm the chair of the Math and Science Department at Keystone College. I'm also the program director for the Public Health Program. Given the COVID-19 outbreak that is occurring right now in our world, the need for public health professionals is extreme. If you like helping people, then public health definitely is for you. The unique thing about the public health program at Keystone College is how our students not only become immersed in the local community, but also various communities in the United States and beyond. I've asked a few of the faculty members in our public health program to talk about these broader experiences that they have shared with students. I hope that you enjoy the video, and I hope to see you in the fall.
Hello everyone, my name is Erin Johnson and I am an adjunct instructor here at Keystone. I teach classes in biology and public health, and today I'd like to talk to you about the Intro to Public Health class. This class introduces the concepts of public health, and we do that through discussion and hands-on learning activities. The class also participates in the health fair that happens at the end of National Public Health Week, which is held in April. So the semester culminates in a week-long trip to Chicago to study their urban public health system, which is vastly different from ours. There you'll have the opportunity to see firsthand the concepts that we discuss in class. You'll also have the opportunity to be introduced to wonderful, incredible activists who are doing absolutely amazing work in their neighborhoods to make them better. In Chicago, you'll be making comparisons between their urban health system and the one that you're used to at home. This trip immerses you in the culture of the many diverse neighborhoods throughout Chicago. One of the ways we do this is by eating at the local spots. The food is one of my absolute favorite things about this trip. While we spend the majority of the time learning, we'll also spend a little bit of time doing the more touristy things. So we'll go to the Willis Tower and we'll go to Millennium Park, which houses the Bean, which is a must-do. So before I go, I wanted to show you guys some pictures of the awesome things that we get to do in Chicago. This is the students at Cheryl Johnson's residence. She runs a social justice advocacy organization, People for Community Recovery. This is us at Diane Latiker's. She is the founder of Kids Off the Block, which is an organization which works to give neighborhood kids recreational and educational opportunities. Both the Intro to Public Health class and the Restorative Justice class go to Chicago. So this is all of us in front of the Lawndale Christian Legal Center, where we participated in a restorative justice exercise. And here we visited the Wood Street Farm, which is an urban farming initiative which helps alleviate the problem of food access within the city of Chicago, and it also participates in job training. So I hope you liked this look at the Intro to Public Health class, and I hope to see you in the fall.
Hi, I'm Dr. Dorothy Anthony, and I teach one class called Public Health at Sea. This is a great class. It actually happens on a cruise ship. And so what we do is we go and we look at the cruise ship as a little floating city. So keep in mind all the things that a little floating city needs. It needs trash. It needs to have a place where people stay. It needs to feed those people. It needs a healthcare system. All those things exist in a very tiny way on a cruise ship. Not only that, but we're looking at people with multiple languages. 27 is the minimum number I think I've seen on a cruise ship. A lot of people from a lot of different places. So it's fascinating how they get their information. They use very few words. They use a lot of pictographs. And so we take a look at that when we go on a tour underneath the ship. So we actually go and we look and we see where the people who work there are and what they are doing underneath to prepare food for us, to keep keep us safe, to look at the laundry. We look at the way that they recycle things. Very, very interesting. We look at the water system, we look at the waste system, and we look at the way life is on a cruise ship, not only for the guests, but also for the employees. So it's a very, very interesting course, and it not only looks at public health systems, but it also looks at things like diversity and how socioeconomic status affects what we work and do. So I would encourage anyone who is interested in our healthcare system to check out Public Health at Sea. It's a lot of fun. We don't work all the time, but we do work quite a bit of the time because it's very easy to work while you're already on the ship. So I hope to see you in Public Health at Sea.
Lastly, the public health program culminates with 2 different yet equally important experiences. Each student is required to complete a 120-hour internship. Because the public health program is so broadly focused, students can complete this requirement in any public health field that interests them. This internship provides important on-the-job training and often results in employment at the internship site once the internship is complete. In addition, each student is required to plan and implement a Capstone research project. This component of the program is vital because all public health practice should be research-based and data-driven to ensure that important outcomes can be met. We hope you have enjoyed this look at the key features of our public health program, and we hope to see you soon.